Good morning, Robert Bastian here of Bastian Voice Institute and Laryngopedia. The reason I'm calling this little presentation Botox Freedom is that there are some proposed changes in the rules that will govern, in a sort of centralized planning kind of way, that will govern the use of Botox for spasmodic dysphonia. And what could happen in that, if it passes as proposed, is that you will lose a lot of freedom to individualize for your own benefit. And I'll give you some examples in a minute. Potentially, you would end up having to pay out of pocket for an occasional Botox injection. And in our environment, with discount for self-pay, that's a little bit more than $600. And so obviously you want your insurance to cover that. And you don't want some centralized planning grid from somebody who doesn't know you to limit your choice and your freedom. If you want to know more, I would go to www.dysphonia.org. That's the website for Dysphonia International, formerly the National Spasmodic Dysphonia Association. So go to that website and scroll a little bit down the page, and you'll see in the news section, it'll say Advocacy Alert. If you click on that, you'll get the whole background for this. And of course, the folks at Dysphonia International will be glad to help you as well if you call them. So to give you a sense of what may be in the offing, and again, we're in the preliminary comment period, let's make an analogy. Imagine you have hearing aids, and imagine that each new hearing aid battery costs $300. So between the two, you have a cost of $600 every time you need new batteries for your hearing aids. And let's suppose that somebody somewhere decides that they don't know you, but they say you only get 3 batteries per year, 3 battery changes per year. Well, imagine you're a workaholic and you work from 6 a.m. till midnight every day. You're in a lot of noisy places, so the hearing aid is working really hard to do the damping in noisy places and adjusting and everything. And so as a result of that, you need 4 battery sets per year. But you're told, sorry, we only give you 3. So your choice is either to go without your hearing aids for a part of each year, or to pay for that $600 pair of batteries out of pocket. Well, that's the idea of what may happen if these proposed changes go through. One of the parts, there are several things that need not to happen, but one of the main ones is that the proposal is that you only be allowed to be treated every 12 weeks. Well, here, maybe that's fine for you, but let me give you some actual patient scenarios that will illustrate the problem. And this one or more of these may apply to you. So a first grade teacher with quite severe adductory spasmodic dysphonia, her voice is about as tight she can hardly talk at all. She's really, really on the severe side. She's been receiving Botox injections for several years, and it's allowing her to continue her profession as a first grade teacher. Without Botox, I think she'd have to quit. But the problem is, she's one of these outlier experiences, and this is routine. Injection after injection after injection, it's the same. She gets her initial weakness, and she accepts as much as she can because she's wanting duration. So she gets her initial weakness, and she gets through that with the help of a little personal amplifier, a little sound system. And then she gets her good voice, but it's only for about 5 weeks. And after 5 weeks, a total of 7 weeks altogether, her spasms come back very significantly. And by 8 weeks, she's struggling and really needing help. And so she comes in and has done for years every 8 weeks. Time after time after time, it's the same scenario. Well, now with this new proposal, she's told, sorry, you can't get them every 8 weeks. It has to be every 12 weeks. So now she's stuck for 4 weeks with an almost unusable voice and it's just based in some guideline made by someone who doesn't know her and doesn't know her particular circumstance, that she's a fast metabolizer. There are people who use it up fast. The Botox kind of dissipates quickly for them as compared to the average person. So there you see one example. That's not common, but it's not rare. Here's a second scenario. This might apply to almost anybody with SD. This idea of needing to adjust for circumstance. So here's a young woman. She's been injected for a few years for her adductor SD, and she usually goes about 14 weeks. She's getting very consistent results. It's working for her. She comes in and says, hey, I'm going to be married, and it's 14 weeks. I'm going to be married, but it's just a week and a half away. And if I get my usual dose, I'll be a little bit weak still. I'll be, functional, but I'll be quite weak, and it'll be a little hard in the close spaces, and at the dinner I'll have a little hard time being heard. I'd like a half a dose, please. And I say to her, absolutely, that makes perfect sense. I agree with that, and that's what you should do. So we do a half a dose. She gets through the wedding beautifully. She says it worked great. She had a very good voice. But now she's back just 7 weeks later because she says, my spasms are beginning to return because she was underdosed on purpose for her life circumstance. And so she's back, and it's now 7 weeks from the prior injection, and she's told, sorry, you'd have to pay for this injection because 12 weeks have not elapsed. That's a scenario, people have a sudden death in the family, they need to give comments at a funeral, and so they need to adjust what they normally do in order to get through an event like that. And this will remove the freedom that they formerly had to make that sort of determination for their own purposes. Scenario number 3 is an older woman who has been treated for 20 years through Bastion Voice Institute. It's been a very good thing for her. She gets very consistent results time after time, but because she's retired, she's moved to a southern state. Now she's had to find a new Botox doctor. She went to see that doctor, got an injection, and there's a get to know you phase, and so as it happens, the injection was 3 weeks earlier and it didn't work. She got no breathiness, she got no benefit. It's as though nothing happened. So she happens to be back in our area because she's visiting her sister, and it's now just 3 weeks from the prior injection down south. She's in our area. She comes in and says, I need an injection because it didn't work. And she's told, well, you'd have to pay for this one out of pocket because your 12 weeks have not elapsed. So most of the time, again, the 12-week interval will work for people, but there are times when it won't. And what you need as an individual is the right and the freedom to say, here's what I need. My doctor agrees with me, and so this is what I need, and please don't tell me that I don't fulfill a checkbox. There's a checkbox somewhere that I don't fit. And so I would say to you, if any of these scenarios exist for you, I would consider being an advocate. Now, time is short because the window for commenting is very close. So call Dysphonia International, go to their website, dysphonia.org, and they have links, they have sample letters. I don't know if calling your representative would help, but there are times when busy people just have to drop everything and say, I have to do something to try to help my community and myself. Botox freedom. You need freedom to make this work for yourself. Hope that helps, and thanks for listening.